I'm Dr. Gnanaraj. We have been discussing about why a rural surgeon needs to know about urology. Initially, we learned that almost 5 to 6% of any OPD patients will have urology problems. Half to two-thirds of this belong to the lower tract, which is the urethra and the urinary bladder. And most of it could be diagnosed with two simple investigations. We learned about bladder pressure studies, systematogram earlier, and then how to do a diagnostic cystoscopy. If there is one procedure which a rural surgeon needs to know, is called DJ stenting. And what is this DJ stent? It's called DJ double J or DJ because it's shaped like a J. So if you turn it the other way, this is J. This is a tube which is placed inside the body from the urinary bladder to the kidney through the ureter. The ureter, as we learnt earlier, is a collapsed tube. It's a peristalsis which keeps pushing the urine down into the bladder. And there are places where the ureter curves and the stones become stuck there. Once you leave a DJ stent, the ureter dilates to about 2.5 to 3 times the original size. And also, when you keep walking around, it causes the flushing, and which helps the stone come down. When you give medication to relax the ureter and also cause a little bit of diuresis, and the patient drinks a lot of water, the body tries pushing the stone out. So once you put a DJ stent, almost 100% of the stones which are smaller than 6 millimeters, they come out. And up to 1.2 centimeter stones have a good possibility of coming out just with the procedure called DJ stent. And you can go through these slides in detail to find out the various indications and why we do it. We are going to show you how we are going to do the stenting. The various steps are first to locate the ureteric orifice, pass a guide wire, and then the stent, and then we need to give them sufficient post-op instructions. So now we will show you how to do the procedure in this model. So the first step is the cystoscopy that you learnt. So you hold the cystoscope like this. This has a small bulge which is smooth. So this is the end which goes inside the bladder. So you hold the penis like this between the forefingers, lift it up so that the curve is straight. Use the index finger and thumb to spread the orifice, insert the scope, and as soon as you go in, straighten it. Then the important thing is to keep the scope at the center and keep pushing it under vision. So then you identify the interureteric ridge and the two ureteric orifices. So the first step is to pass the guide wire into the orifice. The guide wire has two ends. One is the floppy end which goes inside, and the other is the stiff end. If you directly pass the guide wire here, it's very difficult to stabilize it and view properly. So what we do is first pass the pusher. This is what is used for pushing the stent inside over the guide wire. So once you pass that, keep the pusher near the ureteric orifice. Then you pass the floppy end inside. So here you have to pass it gently 1 centimeter at a time. So it keeps going inside the ureter, and once it goes to the kidney, there is a little bit of resistance. So then you stop. Then you ask the assistant to hold the scope, and assistant should note the ureteric orifice in station procedure. This step is very important because while doing this you should not pull the guide wire out. So, use the technique which is called push-pull, push 1 centimeter, pull 1 centimeter. So, this is how you take out the pusher over the guide wire, and if you can see near the orifice, it does not move. Okay. So, once guide wire is visible, you can hold it and pull it out. The next step is to ask the assistant to pass the stent over the guide wire. So, the guide wire is necessary to guide the stent and also straighten the curves in the double J stent. You can pull a little bit more. Yeah. Now you can hold it. So, another important thing is the assistant should hold the guide wire taut. If it bends like this, it does not slide. So, it should be straight, but at the same time it should not come out. So, it is better to hold it close to the body and so that it does not bend, and again push 1 centimeter at a time till the stent reaches the ureteric orifice. Then you put the pusher. Then we use the pusher to push the stent inside. So, the stent has markings to make sure that you do not push it in too much. So, now once you see this thing, then you pull the guide wire out, pull it out. Yeah, just pull it out totally. Then you can put the wire, then you make sure the stent is in position. And then taking it out again is the same procedure, take it out under vision. So, this is a very useful thing to learn because it can save many kidneys. And once you learn how to insert a stent, pulling out the stent also is easier, and this can save lot of kidneys and morbidity and mortality for the patients. Thank you. Unfortunately, it went off to the thing, this thing for replay. Okay, now resistant.